low blood pressure, more than just feeling dizzy. Almost every week in my clinic, or even in my own neighborhood, someone tells me, "Doctor, I feel weak, dizzy, listless, sometimes with a nagging headache." And when I check their blood pressure, it's often lower than expected. Low blood pressure, or hypotension, is common but not always understood. Let's take a closer look through stories, science, and remedies. Take Aisha, a young woman who came to me feeling faint every time she stood up quickly. Her blood pressure? Just 88/56. That's what we call hypotension, when the pressure drops below 90-60 millimeter Hg. For some people, this is harmless, but for others, it can bring on fatigue, dizziness, even fainting spells. Now, why does this happen? Or what is the pathophysiology behind it? Blood pressure depends on two things: the strength of the heart's pump and the resistance in blood vessels. In hypotension, either the pump weakens, the vessels relax too much, or there's simply not enough fluid in the system. Imagine a garden hose with weak water pressure. The water barely reaches the plants. That's how low pressure starves vital organs of oxygen. Now, why does BP drop? What are the main causes? In clinic, I often remind my patients, low blood pressure is not a single disease. It's a symptom with many possible roots. Let me share a few common examples. In real life, the commonest reason I see is people not drinking enough water during winters or even in hot summers. Dehydration results in drop in blood pressure or hypotension. A middle-aged woman with low BP I once treated had both hypothyroidism and adrenal insufficiency. That is, both her thyroid and adrenal gland were not working properly. Her blood pressure was consistently low, and only when we corrected her hormones did she feel her energy return. So here, endocrine reasons were the culprit. Heart conditions are another common reason. An elderly man with heart failure came in with dizziness. His weak heart simply couldn't pump enough force and his pressure fell. Other heart-related causes of hypotension are myocardial infarction, valvular heart disease, and arrhythmias. In severe infections or sepsis, blood vessels dilate dangerously, dropping BP so suddenly that organs are starved of oxygen. Anemia and blood loss are another common reason. I remember a young girl with heavy menstrual bleeding. Her BP was low simply because her body lacked enough blood to circulate. Drugs we commonly prescribe, like diuretics, antidepressants, or Parkinson's medicines, may tip the scale toward hypotension. So the question is never just, is my BP low? But why is it low? That's the real key. For some, low blood pressure just means feeling a bit tired. But in others, it can cause confusion, fainting, falls, or damage to organs like the kidneys and brain. That's why persistent hypotension should never be ignored. In my practice, the first step is always to find the cause. Sometimes it's as simple as fluids, an IV drip for dehydration, sometimes antibiotics for infection, and in more severe cases, medicines like midodrine or fludrocortisone are prescribed to raise pressure. There are simple measures you can take at home. Often, small lifestyle habits make the biggest difference. Drink plenty of water, and even a cup of tea or coffee can give a temporary boost to BP, thanks to the stimulating effects of caffeine. Lemon with salt water is a traditional quick remedy for faintness or sudden low BP. Eat small, frequent meals. Some foods that may help in maintaining BP are beetroot juice, which stabilizes vascular tone, and spinach and leafy greens, which provide iron and folate, useful when anemia is a cause of low BP, while sweet potatoes and carrots provide slow-release carbohydrates that help maintain BP. Slightly underripe bananas, pomegranates, dates, and raisins are recommended, all of which increase blood volume and energy and help increase the circulation. Whole grains, oats, brown rice, whole wheat, when included in meals, help maintain steady blood sugar, preventing sudden BP dips. Similarly, millets, when included in diet, support blood formation, provide group B vitamins for nerve and vascular health, and being rich in complex carbohydrates keep energy levels and BP stable. Other dietary inclusions which may help maintain BP are almonds, walnuts, eggs, fish, and lean meats, which provide protein and B12, whose deficiency may cause low BP. And yes, sometimes you may add a little salt if your doctor agrees. Apart from dietary measures, take care and avoid getting up too quickly, and wear compression stockings if recommended. Traditional healing systems also offer support. Ayurveda suggests ashwagandha and licorice root. Ashwagandha is an adaptogenic herb that supports adrenal health and may prevent dips in BP due to stress. Licorice root, or mulethi, Hindi, can help raise BP by its effect on sodium retention, but it should be used cautiously as it may increase potassium loss. Ginger tea is also known to improve circulation and may relieve dizziness associated with hypotension. Use of basil or tulsi also improves adrenal function and supports blood pressure balance. Rosemary oil aromatherapy or massage is believed to improve circulation and maintain blood pressure. In Unani medicine, herbs like saffron are sometimes used. Homeopathy offers remedies like crataegus. But remember, natural doesn't always mean safe. Always consult a trained practitioner. Now let's look at what science tells us today. A study in the Journal of the American College of Cardiology found that chronically low BP in healthy adults was linked with a lower lifetime risk of heart attacks and strokes. So in some people, it may actually be protective. But another study from the Lancet Healthy Longevity showed that in older adults, especially those over 70, systolic BP below 110 mmHg was associated with a higher risk of falls, fractures, and even reduced survival. Researchers are also exploring links between postural hypotension, that dizzy spell when you stand up too fast, and early cognitive decline, suggesting low brain perfusion might play a role in memory problems. And interestingly, in integrative medicine, trials are examining whether adaptogenic herbs like ashwagandha or ginseng can support autonomic balance and reduce chronic hypotension. Early results are promising, though more research is needed. So the picture is nuanced. What's safe for a 25-year-old runner may not be safe for a frail 75-year-old. The balance matters. So if you or someone you love often feels dizzy, weak, or faint, it may just be low blood pressure. Most cases are manageable, but they do deserve attention. As a doctor, I've seen how the right mix of medical care, simple lifestyle steps, and sometimes herbal wisdom can restore strength and vitality. Take care of your body, listen to its signals, and never ignore what seems minor. Health is in the details. If you found this video helpful, don't forget to give it a thumbs up, share it with friends and family, and subscribe to Herbs and Hymns for more science-backed insights and natural remedies.